Hello, Nurse Paige here. Today we're going to be talking about cataracts, how I would assess the patient with cataracts, and kind of walk through how I would know if they had cataracts by assessing them, and what to look for, and how to treat them. So, specifically, the type of cataracts we'll be talking about is called nuclear sclerotic cataracts. This is the most common type out of the three, and a way to know if someone has nuclear sclerotic cataracts, it's often has to do with aging. So you'll find that a large percentage of elderly patients come in with cataracts. As the lens of the eye, the lens of the eye will become yellow and cloudy with age. A nuclear cataract is most often associated with aging and forms in the center of the lens, called the nucleus. Nuclear cataracts can occur in one or both eyes, and they often impact distant vision. So these are some signs that you can, when you're looking at your patient's eye, what to look for and how you will figure out what type of cataracts it is. The lens of the eye with cataracts or nuclear sclerosis appears cloudy. So with both, it appears cloudy, but you can tell the difference in cataracts and nuclear sclerotic cataracts because they have some differences between the two. In ambient light, a sclerotic lens has an even pearly opacity with a grayish to bluish tinge. Cataracts, on the other hand, appear like a whitish chunks of crushed ice that vary in size, shape, and opacity. So you kind of want to look at the color, the size, the shape of the what's in their eye, and this can tell you the difference between if it's just cataracts or if it's actually a nuclear sclerotic cataracts. So for this type of cataracts or any cataracts in general, typically there's no non-surgical treatment. They usually have to go through surgery to treat this condition. Some risk factors that will be included in getting this condition would be, for example, their lifestyle. It increases your risks if you are a cigarette smoker, long-term use of corticosteroids, sunlight and ionizing radiation in your eyes, diabetes, obesity, and eye injuries. These are some risk factors associated with getting nuclear sclerosis. Also myopia, which is the inability to see things clearly unless they're relatively close to your eyes. Myopia can be a risk factor because nuclear cataracts is associated with myopia, which worsens when cataracts progresses. It's also very common in the elderly population to develop cataracts, so that's another risk factor. As far as assessment as a nurse, I would want to assess quite a few things. I would want to assess recent medication intake. So it is common practice to withhold any anticoagulant therapy to reduce the risk of hemorrhage. So if they're going to be going into surgery, you don't want them to be taking this type of medication because they could hemorrhage. Preoperative tests. So the standard battery of preoperative tests, such as complete blood count, electrocardiogram, a urinalysis, are prescribed only if they are indicated by the patient's medical history. So these are some labs and radiology tests that can be done, but they're not necessarily needed. Stable vital signs are needed before the patient is subjected to surgery. So of course, as a nurse, you always want to take the vital signs for pretty much anything that you do. Patient's medical history. The nurse assesses the patient's medical history to determine the preoperative tests to be required. So like I said earlier, you want to look at the patient's medical history so that you can determine if you do need to perform those tests. And then some examples of tests that you can do as a nurse would be called the Snellen Visual Acuity Test. This test measures the degree of visual acuity in the patient. So this can show signs of cataracts if their visual acuity is, not the way it should be. Ophthalmoscopy is used to view the extent of cataracts, so how far along they are. A slit lamp biomicroscopic examination. This procedure is used to establish the degree of cataract formation, how much the cataract has formed in the eyes or the eye. So these are just some examples of tests that you can perform to check for the different parts of the cataract condition. Some medications to be administered pre and post operatively are, so first off, you'd want to do dilating drops. Dilating drops are administered every 10 minutes for 4 doses at least 1 hour before surgery. Antibiotic drugs. So antibiotic drugs may be administered prophylactically to prevent post-operative infection and inflammation. So this would be afterwards. Intravenous sedation. Sedation may be used to minimize anxiety and discomfort before surgery. So a lot of times it'll be elderly patients, and this can be a serious, scary surgery. So a lot of times they'll be very anxious beforehand. Complications that could potentially happen following cataract surgery include retrobulbar hemorrhage. This hemorrhage can result from retrobulbar infiltration of an anesthetic agent if the short ciliary artery is located by the injection. So this is a possibility. It's not common, but it can happen. Acute bacterial endophthalmitis. This is a devastating complication that occurs in about 1 in 1,000 cases, so it's very rare. And then another complication that can occur is toxic anterior segment syndrome. This non-infection inflammation is a non-infection inflammation that is a complication of anterior chamber surgery. So all these are unlikely, but they can occur. Some nursing interventions that I would take with my patient who had this condition. I would want to provide preoperative care. So I want to use use of any anticoagulants is withheld to reduce the risk of retrobulbar hemorrhage, like we discussed earlier. So I want to check for this. Providing post-operative care. So before discharge, the patient should receive verbal and written instruction about how to protect the eyes, administer medications, recognize signs of complications, and obtain emergency care. So these are just some before and after surgery interventions that I can do with my patient. So as far as psychological integrity, what that is the nurse provides and directs nursing care and promotes and supports the emotional, mental, social well-being of the clients experiencing stressful events, as well as clients with acute or chronic mental illness. So this is just, I want to make sure that my patient feels psychosocially well, that they don't have any, before surgery, I want to check their anxiety levels, see how they're feeling. I kind of want to assess how their lifestyle is in general, like if they will be off work, if they're working, or if they're retired, kind of their mental health background, any medications that they're on. All of these things have to do with psychosocial assessment. So that will allow me to know like what I need to do to best take care of my patient. For the patient teaching, so the nurse always wants to make sure that the patient knows how to take care of themselves before discharge. So one of the ways I can do this with this specific condition would be to make sure that the activities that are to be avoided after surgery are instructed by the nurse. So you want to make sure after the surgery that they're not doing anything too strenuous, or they're not participating in a high level of activity that could cause them to have complications. Protective eye patch, so after surgery they want to cover their eye. This is to prevent any accidental rubbing or poking of the eye. The patient wears a protective eye patch for 24 hours after surgery, followed by eyeglasses worn during the day and a metal shield worn at night for 1 to 4 weeks. So I want to make sure that I'm teaching my patient that they need to be doing this correctly. And then expected side effects, you want to go over that with your patient so they know if they should be expecting anything after surgery when they go home. So slight morning discharge, sewn redness, and a scratchy feeling may be expected for a few days. And a clean, damp washcloth may be used to remove slight morning eye discharge. So you want to let them know what to use and how to use it for the next few weeks after surgery. And then let them know that they can always notify the physician and when to notify the physician. Because cataract surgery increases the risk of retinal detachment, the patient must know how to notify the surgeon if new floaters in vision, flashing lights, decrease in vision, pain, or increase in redness occurs. So if they have any of these signs or symptoms after surgery when they're at home, they should notify the physician. And I believe that is it on nuclear sclerotic cataracts. So thank you.